Great day to you all out there. This is Parindra-Ra. Today's video is going to be on hydrochlorothiazide, the side effects of this blood pressure lowering medication, drug recall, and some herbs to add to your diet to help lower the blood pressure. So hydrochlorothiazide also goes by, or other names for it is microzide, hydrodural, something like that, Ecidrix, Oretic, and Ezide. What are they? What side effects do they have? Okay, so we're going to go over some of these here. Cause pain throughout the body, back, leg, or stomach. Black tarry stools. When you have dark color in your stools as tarry, it indicates bleeding. As you see in the next symptom, bleeding gums. Your gums bleed, you swallow it, it goes down the intestinal tract. However, bloating, blood in the urine, there's more bleeding again. Joint pain, stiffness, swelling. Blurred vision, chest pain or tightness. Now it's really starting to get serious. Huh? Oh, I skipped. Blistering, peeling, or loosening of the skin, which is Stevens-Johnson syndrome. Always like to show a picture of that one. So this blistering, peeling of the skin is a possibility with taking this medication. Why? Simply because it's poison. It's poison. Sorry, I don't know another way to say it. If you know me, you know that I really don't sugarcoat. Anywho, let's go back. And that can be quite painful, as you can tell. Blue lips and fingernails. Now this is showing that a person is not getting enough oxygen, right? So numbness, tingling, pain, or weakness in the hands or feet. This is the start of neuropathy. Chest pain and tightness. Tightness will make it difficult to breathe. Painful, difficult urination. Okay, now it shows that it's affecting the kidneys, urinary system, kidneys, bladder, causing some issues. Why is it causing problems there? Cloudy urine, confusion, coughing up blood, darkened urine. See, now it's dark. Now the urine is dark. So the kidneys filter and then it excretes through the bladder and urethra. And we know that our urine should be on the light side of yellow. I don't. Some say it should be clear. I don't know that that is correct or the best. I'd say clear is definitely better than dark. Okay. Seizures. Difficult, fast, or noisy breathing. It makes it hard for you to breathe. It's possible that it can make it hard for you to breathe. Not everyone's going to get these side effects. Know that it's Russian roulette. Now, this thing is prescribed to lower the blood pressure, but yet it can make the heartbeat fast and irregular. Like, how does that happen? So if a person that's taking this medication to lower their heart rate, they'll take, if they were to get a fast heartbeat, they'll just think that's them. Oh, I have high blood pressure. Trouble breathing. Well, yeah, it's tightness in the chest, vomit in the blood, increased hunger. So this the person could gain weight simply from being hungry on this medication. Oh, there it is right there, weight gain. Weakness, heaviness of the legs, white, yellow, waxy scar area, yellow eyes or skin. This indicates that there is some liver issues going on. Difficulty having a bowel movement. So this could cause constipation. Hair loss or thinning of the hair can cause, so that's alopecia. See, and many people think that alopecia runs in their family, and it does not. It does not, because it's it's the chemicals that are used in washing the hair, the gel, all these different products, medication. Guys, inability to have or keep an erection. Like, come on, man. Muscle spasms. Okay, so it's not something that's really recommended to take. I mean, if you really read the risks, if you really look at the risks. Okay, I got to slide out of order here. Okay, so this was about a drug recall, which excuse me, which quinapril, lisinopril, hydrochlorothiazide was part of this recall back. The company announced it October 24th, 2022. So this was last year. There were there were several recalls last year, with several different drugs, several different drug companies. The problem I have with this announcement on October 24th, 2022 is a picture in my way. This is the problem I have with that. Quinapril and the hydrochlorothiazide tablets. Platinum. This is what they're calling, what they're recalling, because they say it has it does. There's an impurity of nitrosamines. I think I skipped that. See, nitrosamines, meaning that there was too much of this poison chemical inside of it. All the way back, where is it? Oh, I skipped it, sorry. Oh, here we go. So October 24th, 2022, they're recalling two lots from May the previous year. This is a year and a half. How many patients have been taking this cancer causing junk for a year and a half before you say, oh, whoo, hey, we're not in trouble. FDA didn't make us doing it. We're volunteering. Um, yeah, you might not want to take that. It's too late, man. Most of that has been taken, right? So the risk in the nitrosamine is because it causes cancer. Saying right here, nitrosamines are common in water and foods, including cured and grilled meats. Yeah, so the processed meats, the lunch meats, you want to be careful of those. Dairy products, vegetables, quit playing. Everyone is exposed to some level of nitrosamines. I don't believe all of that there. These impurities may increase the risk of cancer. This is why they recalled it a year and a half later. Now, I work in the operating room, and we get our instruments sterilized, meaning that there's no microbacteria pathogens at all. This is clean, 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 sterile. To ensure that the instruments are sterile, we, in the process of sterilizing them, there's a little vial of bacteria that gets run inside of the same machine that runs the load of instruments. Now, once the load of instrument comes out, we take that little vial, crush it, put it on the tester, and within an hour, it'll tell us, hey, the bacteria is there, or no, you need to do all of those instruments over. We know that before it comes to surgery. All right. Still processing lets us know. What's up, SPD? So the fact that what they're telling us with recalling drugs a year and a half later is that they're not doing quality control, which I totally, that's not possible. That's like the water treatment. Someone's testing the water to make sure it's good. Do lifeguards not test the pool every day? All right. Yeah. So thiazides have been linked to skin cancer. This is I say the hydrochlorothiazide is what they call because of the cancer risk. Now the thing with that, with the nitrosamines being in medication, these nitrosamines happen, they occur during the process of making the chemical, putting these chemicals together in a reaction, and it causes this cancer causing crap. And they allow so much of it. They actually allow a small amount of this chemical to be in the medication. So yeah, there's links to skin cancers by taking this medication. Well, we see that the nitrosamines cause cancer, but is there anything else? I wonder. Carcinogen. What's going on with this thing today? See, drug maker Aurobindo Pharma recalled 2 lots of the blood pressure medication, quinapril, hydrochlorothiazide. After levels of the cancer-causing impurity, nitrosamine was detected above the acceptable daily intake level set by the Food and Drug bosses. So this this isn't even on the package insert. There, when doctors prescribe medication to you, they're supposed to tell you of all of the side effects. They're supposed to go over that with you, but they don't take that time. So you know the nitrosamines cause cancer. Is there anything else? Yes. I didn't even look at all of the rest of these. This is all man-made junk, poison. right? Here's some of it right here. This is a this is like a mad scientist manifesto right here. This is in a whole nother language. Hydrochlorothiazide is a diuretic and antihypertensive. So it makes you get rid of water or makes you urinate and lowers blood pressure. It is the 3,4-dehydroderivative of chlorothiazide. It is chemically designated as 6-chloro-3, 4-dehydro-2-H. See, when you mess with, don't mess with stuff like that. Don't mess with stuff like that. So I did find something else that also causes cancer. That's inside of the medication, and it has moved. It's on this page. There we go. I see it. Okay. So this right here also causes cancer. Toxicology of food dyes. Now, this report is by, at least on the website, of the NIH, National Institute of Health. They work directly with Fauci's former department. Food dyes synthesized originally from coal tar and now petroleum have long been controversial because of safety concerns. Many dyes have been banned because of their adverse effects on laboratory animals or inadequate testing. So they've tested this on animals. They know the harm that it causes. The conclusion of the study, this review finds that all of the 9 currently US approved dyes raise health concerns of varying degrees. Red 3 causes cancer in animals, and there's evidence that several other dyes also are carcinogenic. Three dyes, red 40, yellow 5, and yellow 6, which is in hydrochlorothiazide, have been found to be contaminated with benzidine or other carcinogens. I don't know, man. It's really important to not be on medication. It's really important because the medication. So then a person gives medication. I'm sorry, from medication, a person develops a tumor, or they get a cancerous tumor. They now have cancer. Now what? Now it's more medication, and we know what that does. We know what that kind of medication does. Why would a medication make something that's supposed to help your body? Why would it make your hair just fall out like that? It's a response. It's an immune response because the body is aware of the danger it's in from this medication that's now, I don't know why you call this medicine, from this poison that's been inside of his body. And now it's trying to save the vital organs. It's trying to save your heart, your kidneys, your liver. It's trying to save all of that. So it's getting rid of what it doesn't need. So the hair goes. It's a defense mechanism, like a plane, um, airplane flying and the engine goes out. The pilot is going to preserve energy so it can coast, glide, and land somewhere. So they may just get rid of all of the luggage. Hey, the luggage has to go. We don't need that. We don't need the luggage to survive. So that's like the hair. So herbs and supplements for high blood pressure. I'm not much of a supplement person. I do, however, use herbs a lot. Basil. Now, a lot of these you can just put right onto your food. Just put some in there. Put some basil, full of compounds that may help reduce high blood pressure, contains an antioxidant called eugenol, thought to act like natural calcium channel blocker. What? Basil's dope. Garlic. Garlic has its uses. I wouldn't use a ton of garlic though. I think a little bit on the food is good. Thyme, high in rosmarinic acid, supports blood flow, so it's good for circulation, relaxes blood vessels, and fights inflammation. And some studies have shown that it significantly reduced blood pressure. Significantly. Parsley, good source of vitamin C, carotenoids, antioxidants to lower blood pressure and bad cholesterol. Celery seeds, ginger is my favorite. You can make a ginger tea. Now, if you're going to use, these are safe to just put some in your food, but if you're going to make a tea, say definitely a strong tea, like how I like to do, take it either 2 hours before or 2 hours after the medication. Don't take it together. Okay, because you don't want the medication. These herbs will basically detox. The herbs will detox, will start to detox the medication from your system. So if you were to take it too close together, it might feel like an overdose, and we don't want that. So, oh, cinnamon. Cinnamon. I recommend only Ceylon cinnamon. What that was? It was search. So you want to get Ceylon cinnamon because of the looking for the answer as I try to speak it out. They have compounds inside of it. The Ceylon is great. I'm going to say here. The cassia or regular cinnamon is too much of it is definitely harmful. It's the coumarin content. It's too high of a coumarin content, which can be really bad. So if you're going to use cinnamon, use Ceylon cinnamon. And I think that's all for this video. Yes. And please give it a like, share with the loved ones. Thank y'all so much. Peace. I love you.